Always clean your hands off upon entry and re-entry into the PEC. Allow your hands to dry. The ProSat wipes must always remain in the first air from the HEPA filtered. No, they are not sterile once they are open, but they must receive first air so we can ensure they are as clean as they can be. Clean your sterile products into your designated compounding area. When preparing for a compound, remember you have an entire hood to compound in. You want to make sure that the area that's right in front of you is clear for compounding. So spread your products out so you don't have to worry about shadowing. Therefore, the first air can always reach our critical sites. Take a look at the IV bag. The injection port must always receive the first air from the HEPA filtered. If it was flipped around, the tubing port would be blocking the air reaching the injection port. Again, don't be afraid to spread out so that the area that's right in front of you is clear for compounding. Let's talk about organizational flow and where we want to keep our products. I like my products on my right-hand side. You might prefer them on your left, and that is fine. The importance is that we don't cross over when we go to gather a product. Bring your syringe into the designated compounding area, but never allowing the wrapper to touch your DCA. Open it up and pull the syringe out immediately, flipping the tip to face the HEPA filtered air. My garbage is in my right hand, so my bowl should be on my right side. Keep an eye at which hand your garbage is in. Bring in your needle into the DCA, opening it to expose the hub. Make sure to butterfly the wrapper and thread it on to the lure lock of your syringe. Righty-tighty, and dispose garbage. Open up your alcohol swab now for your needle cap and place it on your preferred side. At this point, you're going to want to cleanse your hands as you've touched the dust wrappers, and you want to wash them before touching your sterile products. I like my alcohol swab for my needle cap on my left-hand side. I also like to have a little piece of alcohol wipe so I can clean my fingers after I think I might have contaminated them in any small way. Pull back air into the syringe equal to the volume you want to remove. Remember, you cannot touch the inner plunger of your syringe. Use a sterile alcohol swab to cleanse the rubber septum of your vial following the direction of your airflow 3 times. 2, 3, allowing 10 seconds to dry. Make sure you cleanse your finger after touching that dust wrapper. Best practice, remove your needle cap, with the cap opening facing your HEPA filtered air on the alcohol swab. This is a demonstration using the red blend fill needle, which means I'm going straight in at a 90-degree angle, not from a 45 to a 90 if I was using a pink or beveled needle. Never allow the rubber septum to meet the needle hub, always seeing silver of the shaft. Invert your vial and watch for the airflow. See how you notice the hand is now blocking? Keep your wrist twisted. A lot of times it's just in the motion of your wrist. You could hold it between your index finger and your middle finger, but avoid holding it around the aluminum seal, since you can see the air doesn't actually reach the rubber septum. Just watch for a couple different methods on how to hold. The most important thing to note is that you're always seeing the silver of your needle and the rubber septum as well as the plunger of your syringe here. Having the ease to be able to pull your vial up into the air helps as well you're withdrawing fluid and fluid goes more towards the rubber septum. you can pull your needle back to be able to gather all that fluid from your vial. Another thing to note is how to hold while trying to clear your bubbles out. You do have to clear your bubbles out of your syringe while it is still attached to your vial. While clearing your bubbles out, you still have to make sure that you're not blocking any of your critical sites. Once your bubbles are removed, you can put your vial back on the counter, safely remove and recap your needle. It's important to always place the syringe with the drug to the right of the vial. We do this because of organizational flow within our hood. We may have more than one drug vial in our hood, so having the syringe always to the right of the vial or the left, depending, is important. When you're ready, move your vial out of the way so nothing is going to block your injection into your bag. Wipe your bag port 3 times in the direction of the airflow, placing an alcohol swab underneath the injection port. Safely uncap, placing the needle cap facing your HEPA filter. Support the injection port with your hand and go straight in through the center. You want to pass the inner diaphragms and then depress your plunger. Remove your needle. Safely recap always first. Swab your injection port to remove any drug residue. Pinch your port, give it a little flick. We want to ensure all that drug is in the bag and not pooled in the bottom of our port. Flip from an upwards angle to a down angle. And remember, bubbles will rise, particulates will fall. And what we're checking for here is any kind of particulate matter, coring, or anything that might determine that the bag is not safe. Needles go in your sharps container. Syringes can go into your garbage bowl. Tidy up your hood. The vial will come out of your hood. A broken ampule would be thrown in your sharps.